Maybe I'll go back to comments I made at the beginning of April, and maybe this even goes back to March, that we knew that this was going to be the storm before the calm. That as we went into a transition period, as the vaccine rollout continued, that we, as a province, worked incredibly hard in responding quickly to containing the variants. And that included the border pilot project, which gave us the ability to be able to test the variants for 100% of those samples, those positive samples at the border pilot project, even retroactively, so we could do everything we could to contain and mitigate the spread of the variants as we had disruptions in vaccine supply in February and March from the federal government. And it was a race between the vaccines and the variants. The variants have won. We have tightened restrictions as a consequence of that. If you're asking for specific tightening of restrictions, as I said to Janet's question, we don't have any of those recommendations right now from Dr. Henshaw, but we will continue to make sure that she has all the resources available to her to be able to make the right recommendations to Emergency Management Cabinet Committee and to me. And we'll continue to hear that those recommendations from her when she comes forward with concerns that she might have about the community spread and what tightening of restrictions might be needed. But as we do see the vaccine rollout successfully being rolled out, now that we're having fewer disruptions, we're not seeing disruptions from Pfizer right now, which is good news. We've seen good uptake in the AstraZeneca vaccine, which is good news. And now we have 23% of Albertans who have had at least their first dose. We know as we have more vaccines going, then the cases will reduce. And as the cases reduce, then yes, the hospitalizations will reduce as well. But we do know that we might have concerning case growth, which we know that would be a concern for us in our hospitalizations. And so when we see that level of case growth that is concerning, or certain areas where we think that a tightening of restriction might be able to stop that type of spread, we're going to be getting that information and those recommendations to the Emergency Management Cabinet Committee at that time. The people who are identifying as positive today are people who, this is going back to the Easter long weekend. So this is a lot of times when people present as being positive, it's 2 or 3 weeks before they actually tested as positive that there was transmission. So we knew that this was going to happen. We made it very public that we were expecting, even after we tightened restrictions, that we were going for 2 or 3 weeks to be able to see continued increases in cases. So this is the evidence that we're looking and following, and making sure that that we're going to be making sure that any recommendations we would see from Dr. Henshaw would be presented to Emergency Management Cabinet Committee at that time. Broader measures, layered measures, as we saw in December, are a possibility, but that's going to depend on what the evidence shows. So we don't see that right now at this time. We do see perhaps in coming weeks, if we don't see the tightening of restrictions that occurred a couple weeks ago, if we don't see that in leveling off and bringing down the R value, as Janet correctly pointed out, then maybe tightening of restrictions might be needed. But that's going to depend on that evidence we see at that time. And the Albertans have made great sacrifices, as people throughout the rest of the world have as well. And we've seen, the restrictions that other jurisdictions have also had, as well as Alberta, in times that they were implemented, and being able to help us reduce spread of COVID in our communities. And we know that there are going to be waves, and the waves are going to ebb and they're going to flow. And we've seen that in every other jurisdiction throughout the rest of the world. That's not to say that previous restrictions and previous sacrifices were for nothing. It's the exact opposite. They were very important measures and thank you to all the Albertans who complied with those measures in November, December, January, up until now. And continuing to make sacrifices to limit spread. Let's remember that Albertans are right now there are sacrifices being made right now, and we had further tightening of restrictions that were announced weeks ago. And thank you to all those Albertans for making those sacrifices. It is making a difference. And if they weren't making that difference, then we would see extraordinary growth in the variants right now in Alberta if we didn't have folks complying. So thank you to all those Albertans who are doing that.